Good morning, everyone, and welcome to Pollen Fertility. Before we begin, I'd like to acknowledge that we're meeting in the traditional land of the Indigenous peoples, including the Mississaugas of the Credit, and to express gratitude for the opportunity to live and work here. We are truly grateful to have the Minister of Health, the Honourable Sylvia Jones, here with us today, along with so many distinguished guests, colleagues, and members of the media. Pollen Fertility was built with one simple mission: to make best-in-class fertility care more accessible and compassionate for families across Ontario. For me, this mission is personal. As a patient myself, I've experienced firsthand the hope, the uncertainty, and the deep gratitude that comes with this journey. I also know how fortunate I was to have access to care when I needed it. Every day, we meet people who are filled with the same hope and determination on their journey to becoming parents. And every day, we're reminded that timely access to care can make all the difference. That's why today is such an important moment. The government's leadership in strengthening fertility care speaks directly to the needs of the patients and the families who have been waiting for this type of support. And it speaks to the belief that building a family should never be limited by barriers to access. We're deeply proud to host this announcement at Pollen Fertility. As a clinic, we stand ready to support the province's vision with capacity, innovation, and an unwavering focus on excellent outcomes for our patients. And most importantly, we know that what happens here today will give hope to thousands of families across Ontario. It's now my great pleasure to welcome the Honourable Minister Sylvia Jones to share this important announcement.
Thank you, Melody, and good morning, everyone. What a beautiful space to be able to be here alongside my local colleague and MPP, Michelle Cooper, who has been such an incredible champion for not only this program, but so many others in her riding of Eglinton Lawrence. Thank you, Melody, Kim, and the Pollen Fertility team for hosting us today and for everything you do to provide world-class fertility care to patients and their families. Under the leadership of Premier Ford, our government continues to make record investments to protect Ontario's healthcare system, taking bold and innovative actions to make it easier for patients and their families to connect to convenient care close to home. We are investing in and expanding our hospitals, growing and supporting our healthcare workforce, significantly expanding access to primary care, and of course, improving access to key services like fertility supports, which is why we are here today. There is no role more special or important than being a parent. That is why this year our government has announced the new Ontario Fertility Treatment Tax Credit to offer further financial relief to couples and individuals in their journey to start or grow their family. The credit provides a maximum of $5,000 in annual support by covering 25% of eligible fertility-related expenses up to $20,000. And today, I am pleased to announce that we are building on our government's progress by investing $250 million to expand access to in vitro fertilization under the Ontario Fertility Program. This funding will support 25 clinics, including 6 new IVF clinics to shorten wait times and lists for fertility services in both hospital and community settings. Here in Toronto, 8 clinics, including the Pollen Fertility Clinic right here, will collectively deliver over 2,200 additional IVF cycles as part of this investment. And of the overall investment of $250 million, $50 million for 2025-26 is estimated to fund an additional 5,000 IVF cycles across the 25 new and expanded clinics. Additional clinic locations will be announced in the coming weeks, and the remaining $200 million investment will be allocated in 2026 to improve clinics for fiscal year 2026-27 and 27-28. Approximately 1 in 6 couples in Ontario experience infertility at some point in their lives, and this investment will expand clinic capacity and help triple the number of families across the province benefiting from publicly funded fertility supports, helping them to start and grow their families. With this expansion, the Ontario Fertility Program now funds 54 clinics that provide publicly funded fertility services. And since the launch of the Ontario Fertility Program, funding has supported more than 125,000 Ontarians to help build their families. This is one more way our government is ensuring that the Ontario Fertility Program is better equipped to meet the needs of patients, providing them with timely and high-quality fertility care closer to home. Thank you again to all the healthcare and community partners across Ontario for everything you do to support families during this time in their lives, while helping to support a stronger, patient-focused healthcare system. It's now my pleasure to invite your local MPP, Michelle Cooper, to share a few words. Thank you. Stay well.
Good morning, everybody. I am so excited to be here. As the proud member of Provincial Parliament for Eglinton Lawrence, I am honored to welcome Minister of Health Sylvia Jones to our community for today's important announcement. We are here to highlight a significant investment that will expand access to fertility treatment through the Ontario Fertility Program, a meaningful step forward for individuals and families in Eglinton Lawrence and across the province. Fertility services are essential to many Ontarians, and clinics like the Pollen Fertility Clinic play a vital role in delivering high-quality, compassionate care. We are fortunate to have such a trusted and innovative clinic serving families right here in my riding. As part of our government's plan to protect Ontario and strengthen public services, this investment will support the expansion of 25 fertility clinics across the province and help triple the number of families who can access publicly funded fertility treatment. It will also help reduce wait times for fertility services in both hospital and community settings. Here in Eglinton Lawrence, the Pollen Fertility Clinic will receive $5 million to provide an estimated 517 IVF cycles, expanding access to care, reducing wait times, and allowing this exceptional clinic to continue making a life-changing difference for families in our community. I want to thank Premier Doug Ford and Minister Sylvia Jones for their leadership, and I extend my deep appreciation to the team at the Pollen Fertility Clinic for the incredible work they do every day to support people on their journey to parenthood. Together, we're building a more connected, accessible, and supportive healthcare system for all Ontarians. Thank you. I'd like to call up Dr. Kim Garbedian to the podium. Thank you.
Hi, I'm Dr. Kim Garbedian. I'm the medical director at Pollen Fertility, and I'm a fertility doctor and IVF specialist in Ontario. Thank you, Minister Jones and MPP Cooper, for your leadership and commitment to Ontario families. As a fertility specialist, I have the privilege of working every day with patients who show extraordinary courage and resilience. Behind every chart and every treatment cycle is a deeply personal story. Couples and individuals who want nothing more than a chance to grow their families. But for too many, long wait times or limited access has made that dream feel out of reach. Today's announcement is a meaningful step towards changing that reality. This funding will allow physicians and clinics across Ontario, including right here at Pollen Fertility, to provide timely care, the latest fertility options, and the highest standard of safety and outcomes. It ensures that more patients can begin their journey when the time is medically right, not months or even years later. On behalf of my colleagues, I want to emphasize our commitment. We are, as doctors, nurses, and fertility care teams, partnering with the government to deliver care with compassion and excellence. Most importantly, we know what this means for patients: more hope, more opportunity, and more families finally achieving their dream of having a child. Thank you.
We will now begin to take questions from any media present with questions, so please feel free to line up behind me if you do have one. As a reminder, it is one question and one follow-up, and please state your name and your outlet before you ask your question. Thank you.
Good morning, Minister. Doug Gamming with Global News. The Ontario Hospital Association recently released some numbers saying that hospitals need an additional $1 billion in funding this year. Why is that, and what's your government going to do about it?
Well, actually, we've been working very closely with all of the hospitals across Ontario and the Ontario Hospital Association. In fact, less than a month ago, we asked them to submit their plan to balance, because we know that for the last 3 years, we have given hospitals across Ontario an average of 4% increase. That's 3 years running we have done this, and now we need to work directly with all of those hospital corporations and their boards to make sure that we have, and they have, a plan to balance so that we all understand where the challenges are and where the opportunities are, and we'll continue to do that work.
Perfect. Thank you. That concludes our media availability, and thank you everyone for attending.